It's nice to talk in person for as long as we still can.
Yeah. We're a few feet away from each other. We're social distancing ish.
I haven't touched anyone yet.
You haven't touched you. You're not touching me. Not today. Welcome to Friday. Welcome to the Week in Review on KUOW Seattle. I'm Bill Radke. I'm not working from home. And neither are Joni Balter, host of Civic Cocktail, nor Erica C. Barnett of the CSforCrank.com, nor C.R. Douglas of Q13 News. Welcome, panel.
Hello
Good
there.
afternoon.
Thank you.
Thanks for staying extra long with us.
I'm assuming we're getting overtime.
Yes.
Double, triple, I think that's called.
Of course.
We're all bathed in Clorox, we should point out.
Yes.
Yeah, this is a very sanitized studio.
Very sanitized. We've been listening to President Trump's news conference, and we'll touch on that and what's going on in Washington State, coronavirus and otherwise. And wherever you are, working from home or wherever you are, you can watch us live at facebook.com/KUOW Public Radio. So last I checked, Washington State had 457 confirmed cases of coronavirus and 31 deaths. That was 270 cases in King, about 100 in Snohomish, about 17 in Pierce County, virtually all in the Seattle area. The latest news in Washington State is that Governor Inslee has now closed all the schools in the state, K through 12, higher education too, right? I'm told, public, private, charter schools until at least April 24th. Earlier in the week, he had closed schools just in King, Snohomish, and Pierce counties.
This school closure is going to be tough on families. They're going to be there tonight trying to figure out childcare. There's going to be questions about when we actually can fully get back. And so this is going to be really hard on families, and we shouldn't diminish that. So I think it's a moment that I hope everybody can pull together. I hope that if you want to have a shining moment where you can help your community, you're willing to talk to your neighbor and see if they can need a hand with childcare or some other or transportation.
And the school system says they'll help. The state superintendent of public education, Chris Reichdahl, said schools will support students and families.
This is a moment for our organized labor partners and our superintendents and school boards to have a relentless commitment to the shared sacrifice of Washingtonians. We have to provide these essential supports to each other in our districts, to our kids and their families. The work will be different. There's going to be expectations that don't look like a traditional school day, but our commitment to vulnerable populations, food and nutrition, and getting our seniors and juniors the credits they need to transition will continue to be the initial work that we do.
And here's some of the other ways that Reichdahl said the school system will help students.
We're going to use bus drivers, for example, to deliver food. We're going to use para-educators and some teachers to make sure that our most vulnerable kids get supports. We're doing one-on-ones already with seniors to make sure that the continuity of their learning continues. Our work is moving forward. It just looks differently.
And I'm going to play one more piece of audio from Governor Inslee before we hand it over to you, panel. The governor banned gatherings of more than 250 people now statewide. So that's concerts, sporting events, big church services, conventions, and festivals. Started out as a King, Pierce, Snohomish County thing. Now that is also statewide.
This is a moment where all of us can be leaders to ask whether we really need to be in close contact in any conditions that are really not essential. Now that's really hard to think about, but it is true. And almost for everyone who doesn't have to be in close contact for the next several weeks at least, I'm advising them to think about that seriously.
All right, let's turn to you. I'll pause at that. Your reaction to the news.
Well, I think I've been impressed, and I think the nation looking at Governor Inslee should be impressed that at his calm and just the way that he's handling this situation. I think really is a credit. And, I would defer to the advice of the scientific experts who are saying, it is the best thing to do to close the schools. Now, I don't have kids myself, so I will not be suffering in the same way that I know a lot of people I know are suffering with little kids at home running around screaming. And
the kids who don't have meals,
and the kids who don't
child care issues, and all of that.
Yeah, the Seattle School District is providing meals to kids, which I think is great. There was some question about how that was going to be handled, even at Inslee's press conference earlier this week. I think what he's saying is right. It's going to get weirder before it gets. To paraphrase, it's going to get weirder before it gets less weird.
I think Jay Inslee has really lived his line in one of his announcements this week, he said, we cannot shrink from this moment. And he certainly has not. And he has had to take so many different steps as the week has rolled out, and the prognosis has probably gotten a bit worse. Things that we have to do to flatten the curve. That's what this is all about. It's all about, and you've all seen these charts everywhere that show that if you allow this to go with big crowds and everybody gathering the way they normally do, you will not be able to flatten the curve of the number of people who are testing positive and getting very sick. And that will overwhelm our hospitals. And that's one thing that we do not have the ability to handle.
So flattening the curve, meaning at the very least delay some of those.
It's about buying
demand.
time. Yes, indeed.
I mean, listen, we're the epicenter for this problem, and it's not a surprise that you're seeing the most dramatic restrictions of any place in the country right here, led by Governor Inslee. The interesting thing is we don't have a choice, really, because when the testing is so limited, even after today's press conference, where we'll get more testing based on what the president and others have said, it's still going to take a long time to roll out. The only thing in the toolkit really is social distancing. And Joni pointed out the numbers, and or the trends, but let me just give you some numbers. There is an expectation that if we didn't do anything here in Washington, if we just kind of life as normal, we would go from about 1,000 cases to 25,000 cases in 1 month. I mean, just an exponential increase. If you apply social distancing and we all just reduce social contact by a quarter, just by a quarter, the number goes from not 25,000 in a month, but less than 10,000. I mean, so you don't even have to be very perfect at this social distancing, and it dramatically improves where things are. And then if you cut your social contacts by 50%, it's you get close to almost zero. He's doing the right thing. We have to do this. It's unprecedented, but it's going to make a difference.
So somebody asked, do these kinds of executive orders work? And how do we enforce them? I mean, first of all, they have to work because people are scared themselves, and so people are self-enforcing here. I think one of the questions was, well, what if somebody doesn't follow the rules? And Inslee answered that at that press conference, I think it was yesterday, where he said, well, then you'll kill your granddad if you don't. In other words, it's not like we're going to have public health police running around here finding out that you have a wedding and, oh my gosh, there's 251 people who are supposed to attend, call up and rat them out. This is self-policed. It's educational, largely, speaking with the county executive's office. They want it to be educational, not punitive. But we kind of have to do this so that we can reduce the number of cases that are coming. It's going to be a tough 8 to 12 weeks for business, for everybody.
Well, ultimately, I mean, Inslee does have the power of the National Guard, and he pointed that out the other day, that he could use that. But I think what we've seen here in Seattle, at least, is that people are just voluntarily going along, whether it's for selfish reasons because they don't want to get sick, or because it's for altruistic reasons because if they are getting sick, they don't want to get anybody else sick. So, I mean, we've seen a phenomenal amount of self-policing, and it's very hard to imagine that he would have to use those powers in any way. King County Executive Dal Constantine also said, look, we're also banning group gatherings of under 250 unless you can, abide by all these CDC recommendations like social distancing, hand washing, et cetera.
Disinfecting.
Yeah, exactly. And somebody asked, well, how actually, I asked that, how are you going to enforce that? And he said, well, it's complaint-based, so you can rat out your neighbors or rat out your local bar or whatever. But again, I mean, if you just go around Seattle now, it's a ghost town, and people are just doing this on their own for whatever reason.
If you pause on that in just a minute and think about that, I mean, it's actually remarkable. I mean, here is the governor imposing some of the most draconian social restrictions we've ever seen, certainly in my lifetime, and that we've ever seen really in this country. And the working assumption is it's just going to happen and people will do the right thing. And the fact is that's actually true. I mean, it's amazing how little pushback there is to this. I mean, if you had said a month ago, 2 months ago, that by early March, your social and economic conditions in the state would come to a complete screeching halt and your life would be dramatically overturned, and there would be no pushback and no rebellion, and you would have said crazy, and it's happening.
Well, one thing about that though is I think it's one thing to say, and Jay Inslee, I saw a tweet that he, thanking everybody for staying calm and not resisting yet, but this is a long time rollout. I mean, one thing I'm concerned about is that over time, everyone's going to relax a little. We're all like frightened, so we're doing things. I have gloves on, but will I have those on in 4 weeks or 5 weeks or 6 weeks? Will people be willing to curtail all this interaction over that long period of time? One of the things the county executive's office told me today, for example, if they get word of a restaurant that's not doing social distancing, it's not like they're going to go knock on the door and punish them. They're going to send them a letter to say, could you please consider? You seem to be putting people way too close together. Could you consider and do something differently so that it's safer for people who come to your establishment?
But isn't the idea, part of the idea of flattening the curve is that we need to be hyper vigilant now. The conditions in 6 weeks may be a little different in terms of, of how many people have actually gotten this infection, in terms of just the kinds of behaviors that we're being. It's hard to imagine, although I would have said that, 6 weeks ago, that the situation now is hard to imagine, but it's hard to imagine schools just being canceled indefinitely for, 6 weeks, 6 months, a year. Because the virus is still spreading, and there is, there's talk right now that there could be a possibility of another uptick in the fall. So I think it's a very rapidly developing situation, and I share your concerns that people kind of get complacent and say, I can't do this anymore. But my hope,
and many of our governors have called themselves the education governor. It's all about education. Remember that. And is anybody here sorry we don't have Governor Iman running our state right now?
That's another show.
That is another show.
Let me just say one more thing about this. I said it was really the only tool in the toolbox, really, until you have more widespread testing, that is social isolation. There is a downside. This is not a perfect solution. Basically, we're talking about home isolation, right? Basically, stay, there's not a lot of other places you can go at this point when you look at this list of banned places and events. Home isolation is not perfect. In China, they stopped home isolation, which is one way they got control of it. They're getting control of it because home is like the definition of social closeness. And there was a heck of a lot of contagion within families in China. And not until they stopped home isolation, put people at isolated sites, did it actually start working. So home isolation comes with a lot of problems. You got to make sure if someone's infected or symptomatic, they're kind of in a separate bedroom. Pets are a problem. Dogs licking everything. And, just that ought to be noted.
Another issue with home isolation, and of course, as a freelancer, I self-isolate by definition.
That's your life.
So for me, my life has not dramatically changed in any way, and my workday hasn't dramatically changed. But home isolation is isolating, and when you have people who are depressed, people who rely on social outings and social gatherings to deal with mental health conditions, when you have people who are just used to working in an office and who suddenly are sitting on their couch and trying to figure out how to have a work day, there's a lot that people are going to have to adjust to. And
when I talk about that, over time, I'm thinking about domestic disputes. I'm thinking about, be nice to everybody in your house because you're going to be there a while and you don't want these things to escalate.
And on that point, this is also, this has been pointed out online by people smarter than me, but this is also trapping people who are in domestic violence situations in their homes, with their abusers. There's just a million different individual situations where being in the home all the time is problematic, even if you don't have kids and dogs licking you and and people bringing in this virus from outside. It's just
pre-existing social conditions end up being a problem.
Yeah.
too.
We barely touched on this. I really want to talk about the local economy now because you mentioned downsides to this. There are so many businesses shutting down and workers, people out of work. I guess the best known would be the Tom Douglas restaurant empire. He said he's closing 12 out of his 13 restaurants for at least 2 months because of sales declines of up to 90%.
We've been crying together all day. lots of hugs, lots of, apologies. Sorry that this is going this way. We're talking about people, my friends, my pals I've been working with for 30 years, some of them.
This closure affects 800 employees who won't get a severance. They'll have to apply for unemployment. We're talking about restaurant workers. We're talking about, you name it, event workers, gig workers of all kinds, arts groups and performers, small businesses, big businesses. Boeing is hurting. This is we can't tote up the costs yet.
I think it's going to be, sort of a mind-boggling change, transformational change of our businesses. Small businesses are a big concern. I happened to speak with Tom Douglas yesterday because, he hosts Civic Cocktail there at the Palace Ballroom. And he was complaining and lamenting in a nice way the hit that sort of the Seattle area has taken to its image on national TV. People are often talking about, gosh, all the problems in Washington State. You heard the president in the press conference just allude to Washington, And so these businesses are not only contemplating sort of the day-to-day troubles that they're having, but how are they going to recover long-term? Because, the hotels are like half full or way less than that. Closing your restaurants for this period of time, imagine that. And so it is going to be our world is going to change dramatically.
I'm picturing these restaurant closures a little more from the point of view of the 800 employees who are losing their jobs with no severance. I'm not looking at Tom Douglas's books, so I don't know, if everything he's saying is accurate. He is the person who said that his restaurants would have to go out of business if there was a $15 minimum wage. It would be nice if there was some way to provide some kind of benefits or severance pay to these people, these hundreds of people who are suddenly without work. But I imagine this will be happening, in a cascading way across all kinds of industries. And
that's right.
The mayor has proposed a whopping $1.5 million for small businesses so far, for very small businesses, which is obviously not going to be adequate in the long term. It's $10,000 grants of up to $10,000 for micro businesses that have physical storefronts. And so that's good. That money's going to run out real fast, and I don't think it's going to go very far. And I think that there's going to have to be a much bigger local stimulus.
Well, certainly the Seattle Foundation also is working with some of the bigger companies to put together a fund. I think they were already at $5 million. There's going to be way more for small business. Is it enough? I think sweeping.
I mean, part of what's going to happen because Trump declared it a national emergency is there will be a lot more money flowing from the federal government. Congress is on the verge of some kind of package. I wouldn't be surprised if it approached $1 trillion. That's going to clearly include some extension of unemployment benefits. So there'll be some relief for this. But I guess one silver lining, if you could say, is that this hit at a time, I mean, in some ways it couldn't have hit at a better time. Locally and nationally, we were humming along at some of the best economic numbers we've ever had, lowest unemployment, low interest rates, So if this had hit, and it's just an accident of history that it hit at this time, but let's say it hit, in 2008, 2009, I mean, ouch. So we're starting from a very cushy position, thankfully.
Let me just quickly hit a few suspensions. I couldn't possibly cover them all. The Space Needle closed down through March. Huskies canceling sports. Major League Baseball suspending spring training, so the Mariners season won't start until at least April. Seattle Public Libraries. I saw, we mentioned Tom Douglas. Canlis went a different route. They're switching from fine dining to drive-through burgers and a breakfast bagel shed, and they'll start a delivery service.
That's a real change for Canlis.
Yeah,
different brand.
But I admire the nimbleness.
Listen, drive-through's the name
they went
of
from
the
upscale to burgers.
Drive-through is a concept here. They're using it for the testing. And a lot of people would like to be able to either walk through or drive through and not have to do that whole.
Who knew that Canlis was
human
going to somehow be
interaction
competitive
thing.
with Dick's?
Speaking of which, can we talk a little about the Trump news conference and the testing? There's a lot to talk about, but for one thing, he had all these executives behind him, the Walmart and Target, Walgreens, et cetera, saying that you'll be able to go to a Google website, we don't know when yet, enter your symptoms, and come to their drugstore parking lots for a drive-through coronavirus test.
I think he said it. I believe he said tonight it will be available. I could be wrong.
I think Mike Pence said that on Sunday they'll be able to tell us when the website will be ready. That's what I heard.
Okay. My reaction to that is, it was the press conference just, as all Trump press conferences, was bizarre on so many levels. But one was like this idea that private industry is going to save us. And if we just sort of put our hopes and dreams in the hands of Walgreens, Walmart, Google, Target, and LabCorp, then everything will be fine and he kept saying these brilliant companies, these geniuses. My question, a little more specifically about the drive-through tests, is not everybody has access to a car.
You can walk through.
Well, okay. He actually didn't say that, and there are a lot of drive-thrus that won't let you walk through. So, as somebody who has tried to do that before. But perhaps they'll let you walk through. I don't know. That was not said in the press conference. But even if you can, not everybody has access to go get to a Walmart. If you're in a rural area, you do need a car to get there. If you are in a city, you may not have access to a drive-through, period, because people in cities don't have cars. And so I guess maybe this is a minor point, but it does seem to me that this is an anti-poor and anti-urban measure. And I find it very hard to imagine that very low-income people who are reliant on buses are going to be able to get to Walmart to possibly be able to walk through a drive-through in their parking lots. So to me, that's a concern as we think about who is actually going to have access to testing. As was the fact that he said that people shouldn't get the tests or can't get the tests until they've already exhibited symptoms.
So it makes my head spin listening to them talk about what the deadlines are and when this or that X number of tests will be available, because they've been at it for a couple of weeks and none of those numbers or deadlines have actually occurred. And so it doesn't really matter what they said on that. The main thing that they know they made a horrible mistake on is the slow testing, the difficult testing, and basically, for some people, a lack of availability to get to a test. And so that is the thing that they were trying to say. We're going to team with private industry, and once we team with private industry, there will be more tests. And hopefully that's true. But as you heard, one of the worst lines in that press conference and speech there were that does the president take any responsibility for how slow the testing was? And he said, no, I do not take any responsibility for that. And that, there was this theme through it that, this system was not set up for a now kind of situation, and sort of seeming to say that, we didn't do anything wrong. I mean, I think it would be a lot better if you just say we were kind of slow out of the gate on the tests.
I was actually encouraged by the press conference. I mean, I guess I've read it a little bit differently than Erica. I mean, I think private industry is something you do want to be involved. I mean, some of these private companies like LabCorp and Quest Diagnostics, they are experts at testing. So you ought to get them involved here. My question is, where was this press conference a month ago? I mean, why did it take now to get all these people together in one room, speak in one off one script about testing? We knew this weeks ago. I don't get that. I also agree with Joni. It was completely unclear to me how many of these tests are going to happen, where exactly they're going to be happen. Should you take it or should you not take it? Can you get it from your doctor, or do you got to go to a Walmart parking lot drive-through? I mean, it was for a press conference, it was exclusively about testing. It was very unclear exactly what the testing regime is. And I'll say one more thing. I was surprised it was exclusively about testing. Nothing about social distancing. A little bit about washing hands, but it was an aside to a testing question. I mean, why was there no message about we encourage social distancing? We're encouraged about what some of the states are doing. They are canceling some events. We encourage more people to do that. I mean, like the best tool we got is social distancing, and there was virtually nothing about it.
And there was a suggestion that you can just go to your doctor and get a test. And I think that's number one, it's not true. You can request a test, but good luck getting one. And B, it's a little irresponsible to suggest that people put a burden on the already overburdened healthcare system to ask for a test that they will not be able to get because it clearly doesn't exist. I mean, there are just not enough tests anywhere right now.
Thank you. Speaking of which, can I want to? We've gotten several questions about testing along those lines. So I'm gonna tell you what I know, and I don't know how the Trump changes in the Walgreens, et cetera, and Google website affects this. But the state health department says that the University of Washington Virology Lab has the capacity to test as many as 750 people per day. That's 1,500 tests because you test a couple of times. Right now they're running about 700 to 800 specimens a day. Their goal is 5,000 tests per day. The state public health lab got more testing equipment on Friday. They put it into service, ramping up capacity. They can test 200 samples with a 48-hour turnaround time. The goal is 400 samples a day, which again means about 200 people. And they got commercial labs across the state trying to get online. The King County Public Health told me that tests are ordered by, as you said, healthcare providers. They either have to collect a specimen or arrange for collecting a specimen. If you have symptoms and you're concerned, you're supposed to call your primary care provider. If you don't have a healthcare provider, you can go to an urgent care or an emergency room, but it is vital that you call ahead before going to the facility. So if you have a primary care provider, they'll ask you about symptoms. I guess they take your word for it. You tell them, and if they decide to get you a test, the primary care sites collect a specimen and send it to a lab. I'm told there's not a shortage of testing kits. It's actually not a specific kit for most. It's like mostly a regular nasal swab. But this is what I'm told is that there are, unlike what a lot of us think, there are no restrictions on how many tests can be sent to the labs, but healthcare providers are limited in their capacity to collect these specimens because of protections that have to be in place to do it safely. And the state says, although the lab test is available and becoming more available, there are limitations in our public health and healthcare system's capacity. And finally, I'll pause. Not everyone who is sick needs testing, particularly if you have mild illness, says the county. If people are not severely ill, they should follow the guidance for self-care, stay home, stay away from others, self-isolate. They do not need to be tested if they have mild illness, as the test results will not change how their illness would be treated, and often the test results would become available only after their symptoms are gone. So I know that was a lot, and maybe you can add to it, but there's just been a lot of confusion around this.
I thought that was really helpful to go through the whole bit, and knowing that, you know, some of the predictions about where tests are and how available they are have not come to fruition. That's absolutely what's been going on. As for this press conference, oh my gosh, it is many days late, and it was at least $50 billion short until it got here. And so that money, we should be hopeful, grateful that it will come, some of it, quite a bit of it, to Washington State and help us. We're getting to the point where we'll probably need FEMA tents for people who have nowhere else to go. We might need FEMA medical facilities if our hospitals become overwhelmed. That's one of the biggest concerns, is that the hospitals will not be able to handle the load that is coming, especially on that higher end of the graphic that shows so many people being affected by this.
One thing they're doing in China, which has helped, is they're doing fever checks, and that's immediate. I mean, when you walk in any building in China and any place, there are fever checks all over the place. And then anyone who has a fever, okay, then we bring you aside and then do a larger test. So, fever checks are immediate. At least that's a specific
number instead of a description
and it's
of
also
how you're
something
feeling.
Right, and it's immediate.
Yeah.
I don't know if we're going to talk about the populations, the vulnerable populations that you kind of alluded to, people who don't necessarily have anywhere to go. Mm-hmm. But they're in King County. I mean, I think that they are going to reach a really critical point soon where there are not places for people who are homeless and for people who just simply can't go home in quarantine because they have elderly family members, because they have people that they don't want to get sick. And we heard today from King County that the motel in Kent, where the person left against medical advice, is now going to be for people who are there voluntarily, for people who could go somewhere else but are self-quarantining for voluntary reasons.
Yeah, can we catch people up on that?
Yeah.
King County bought a motel in Kent, and they have also modular units in White Center, right, in case they need the quarantine space. And what happened? Somebody voluntarily checked in, a person experiencing homelessness, and then they left yesterday without permission?
I think Joni might know more about this.
No,
yeah.
just reading the same thing you're reading, that this person then decided to leave and then decided to go over to a convenience store and then decided to get on a bus, all of which caused troubles at all those locations.
They were awaiting test results. They had not. They're still not a confirmed case. That person, right?
That's right.
Yeah.
It has. I don't think it has been confirmed. I think they were showing symptoms.
Okay.
But I think I think that that the county, the larger problem is that the county simply does not have the capacity to just keep buying motels. I mean, this one cost $15-point-something million, and it's costing $6.5 million to staff. So I mean, repeat that over, and it's 85 rooms. So repeat that over 5,000 people, 10,000 people, 25,000 people, and you just very quickly run out of capacity, and you have to start doing other things. And for people experiencing homelessness, there are these modular units they're setting up on county property elsewhere.
Three locations: North Aurora, Elliott Avenue, and White Center.
Yeah, and so there's three of those. So that's capacity for about another 50 people, I think. Point being, we're going to run out of that capacity, and there's going to have to be a tremendous outlay of money. Right now, they're looking at alternate sites. I was told just this morning that they're considering some short-term leases of properties, not necessarily buying another big, expensive property like they did right out of the gate. But I think we're going to have a real problem with, particularly with the sick population of people without homes and without the ability to quarantine at home.
What the Kent situation tells us, though, is that they'll make a plan, and they can't exactly foresee all the things that will happen. It was assumed that this individual, they had one person there, has already caused these other troubles that they hadn't planned for, which is why they're now going to keep it tighter. People with one set of problems, basically testing positive for coronavirus.
But right now, you can't prevent people from leaving against medical advice. I mean, there would have to be some sort of further order saying, that people are essentially imprisoned at hospitals and can't leave, like an absolute quarantine. And we don't have that right now.
And if you think about it, I mean, shelters are pretty analogous to the hotspot we have in the region, which is that elder care facility in Kirkland. I mean, here you have vulnerable people, compromised immune systems in a lot of cases, in super close proximity. I mean, it's just a hotbed of problems, and I think Eric is right. That's a emergency waiting to happen.
Well, that's why some folks who are homeless actually will say they don't want to go inside a shelter. The distance mat to mat is just too tight. It's not 6 feet of breathing space and that. So you'll see.
And it's about to get cold, by the way, below freezing.
Yeah, today. And that's one of the reasons they added the exhibition hall, to kind of just create that space. You need the spatial distancing to protect people.
And that's for just one provider. That was for the Downtown Emergency Service Center. So they have to deal with all these other providers. St. Martin de Porres is exactly what CR was talking about. It's mats right next to each other. Mostly elderly men.
It's 200 guys.
Yeah, with underlying health conditions. And so the city has told me, we're working on a plan to get some more large spaces. I don't know if it's going to be like the stadiums, if it's going to be, something like the exhibition hall. But I mean, expect to see large spaces filling up with shelter beds that are, maintaining that 6 feet. But I mean, again, it's just going to be a complete transformation of that system too for people who are still healthy.
I want to add one more detail about testing, which is about criteria, because I get asked this too. The criteria the state says has been widened to include people who are hospitalized with symptoms that are otherwise unexplained. That is in addition to testing people with travel history, the hot spots, and people with contacts to a known case of the coronavirus. And the state says these criteria may evolve to include more people over time as the situation is evolving rapidly. Oh, yeah, no kidding. So that's what we know about testing. What else should we hit? The state legislature they've adjourned their session. They're adding money, $200 million for COVID-19.
Yeah, I think that's an important point here. At the 11th hour, I mean, literally about 11 o'clock last night or late in the evening, they did do their supplemental budget and then adjourned. It did include, as you say, $200 million specifically for coronavirus, combating.
But no tax increase for it.
No tax increases. They took from the rainy day fund, of which there's, a nice chunk. $175 million. I think the way that breaks down is $175 million is for kind of immediate coronavirus stuff. I mean, testing and hospital and public health assistance and first responders and all that kind. And then $25 million, going back to our earlier conversation about business relief, $25 million goes to, helping small business and others who are suffering. But you're going to burn through $25 million pretty quickly.
We are
at
not
the state level.
Our local hospital. By the way, this is haven't said in a while. You're listening to the Week in Review on KUOW Seattle, and I'm talking with Joni Balter from Civic Cocktail, Erica C. Barnett. The C is for Crank. C.R. Douglas from Q13 News. We are not yet rationing health care in the Puget Sound area, right? But I'm reading about tales from Italy of doctors making moral choices, they call it, saying patients with the highest chance of success can go to intensive care. They may have to do an age limit for access to patients with health conditions, pre-existing conditions. They're in a worse state of overall health, so they require more resources. Those who are too old to have a high likelihood of recovery or have too low a number of life years left, even if they should survive, will be left to die. That's things like that coming out of Italy, and warnings that, don't think you can escape it. I don't know. That
is exactly the scenario we're trying to avoid here. We're trying to make sure that we don't overwhelm the hospitals, because Italy, it's a terrible phrase, but that's essentially a death panel, because Italy got caught with too many people getting coronavirus too quickly. They have an elderly population in general. It's an older population. And so they have like 900 people in ICU. And so the next person that wants to get in, that's the judgment they're trying and having to make. We don't want that to happen here. And so what you are hearing here is that people are being told, elective stuff, no, don't call the doctor unless you really need to. Don't ask your everyday questions of your doctors. They're completely overwhelmed. They're willing to help you if you need them. Of course, definitely. Don't stay away from a doctor that you need.
But who wants to go to a doctor right now?
That's actually a terrible spot to go to if you can avoid it.
By the way, President Trump said he might add the United Kingdom to the Europe travel ban. I didn't realize this. The World Health Organization says, quote, Europe has now become the epicenter of the pandemic, with more reported cases and deaths than the rest of the world combined, apart from China. More cases are now being reported every day than were reported in China at the height of its epidemic.
Yeah, and I think Trump's actually going to look smart for that Europe travel ban. I think in retrospect, he looks smart for that China travel ban. There are a lot of cases that were coming in from Europe. We've got enough problem with the homegrown cases. We don't need more. So I think he may, and he alluded to it, add the UK to the list soon.
But at the top of the press,
does it make sense to? At this point, it's out in the wild, right? It is spreading in the United States. It doesn't seem to me that a travel ban this late in the game necessarily is going to prevent more U.S. cases. It feels to me, and maybe this is just my personal bias, having watched the president institute travel bans in the past, it feels to me that this is part of an effort to make this seem like something that is an outsider disease or virus rather. And that this is, it is made in China, or it's coming in from Europe, and it's foreigners that are bringing it in. But at this point, it is in the wild in the U.S.
I don't have an epidemiological answer to that.
Well, I will just say that, Anthony Fauci and the other experts that we're all looking to advised and recommended this ban, both the China one and the Europe one. So there is something.
They were also all
to it.
shaking hands up there and not
licking the microphone,
touching the podium,
touching the microphone, not exhibiting social distancing.
How about can we pause on coronavirus and then and take a break and come back and talk about the fact that we voted for president and a couple other things?
Can I make a really quick point that just came through via text about restaurants? People are being advised. One suggestion that I've heard is buy a gift card now and spend it later, and that's a way to help out restaurants without actually going there if you're not able to.
Yeah, I hope to make some room for some ideas like that toward the end of the show. Very good. Erica C. Barnett, C.R. Douglas, Joni Balter. I'm Bill Radke. We're going to take a break and come right back with more of the Week in Review. Thanks for hanging with us.
The program will resume in a minute. KUOW 94.9, Seattle's NPR news station. Sound stories, sound voices. It's 2:45. Rainy and 39 degrees in Seattle.
Support for KUOW comes from Geico, offering motorcycle and RV insurance. More information available on motorcycle and RV insurance at geico.com/Seattle or 1-800-947-AUTO.
When you donate to KUOW, you're doing your part to keep fact-based journalism thriving and accessible. And you're making sure your neighbors and fellow citizens also have access to this valuable resource. At KUOW, we believe a better future starts with an informed community. If you feel the same, join us by making a contribution today at KUOW.org. Thanks.
Support for KUOW comes from Premera Blue Cross. Premera is supporting local communities across Western Washington by covering COVID-19 testing without copay or deductible for most plan members. Learn more about how care is covered at Premera.com.
Continuing on with the Week in Review on KUOW Seattle, I'm Bill Radke with Joni Balter, Erica C. Barnett, and C.R. Douglas. So that was a lot of coronavirus. I just want to mention that our state voted for President of the United States. 87% of the ballots are counted. Joe Biden leads Bernie Sanders by about 27,000 votes. Elizabeth Warren, so that, again, the Biden lead, 27,000. Elizabeth Warren, who's not running for president, has 134,000 votes. Here's what happened. Our state moved our voting up earlier in the year from May to March, so we'd be more relevant. Except our primary ballots were full of candidates who dropped out of the race by the end of voting. We vote by mail here, so people could vote in advance without really knowing what their choice meant. Oh, and we changed it so you had to declare a party. Tens of thousands of people who mailed in their ballots didn't do that, so they had no vote, not to mention all the people who didn't send in a ballot at all because they didn't want to declare a party. Is fiasco too strong a word?
I actually don't think it was a fiasco. I think that there were some lessons to be learned about early voting. If you voted early, you know, some of your candidates weren't there when you were sending in your ballot. I actually thought with coronavirus, we looked like geniuses out here with all vote by mail. A lot of people were, you know, why do I have to go to a poll, to a physical space to vote when those folks out in Washington with all the troubles they have, they don't have to go into a close, cramped space and wait in line to get their ballots. That seemed like a good thing. As for the results, I mean, you know, the revolution has been canceled. Bring me Joe Biden, the sort of municipal bonds of candidates who slow, steady, you know, take care of us here, please. You know, that kind of thing. Definitely. And the most important place for Joe Biden, incidentally, was King County, because you would have thought going into this election that if Bernie Sanders was going to win a county, it would be King County, and he did not win. So the voters, you know, collectively all came to that decision, you know, after subtracting all the votes for the people who didn't end up being on the ballot.
Well, I think I know what happened, and this is not like an original observation, but everyone that I personally know who was a Warren supporter who voted late, which I voted very early, and of course got my ballot back very early, saying that I had failed to pick a party because
intentional or not intentional?
Totally unintentional. I'm a dum-dum. But everybody I know personally who voted for Warren or who supported Warren voted for Biden. And I'm sure it's not universal, but I think there was this expectation among Bernie supporters that all the Warren supporters would just go to Bernie because they have fundamentally the same policy positions, without realizing the impact that the incredible outpouring of negativity from some Bernie supporters towards Warren supporters, calling them snakes, abusing them online, just generally being horrible.
But we don't judge the many by the actions of a few, right?
The fact that the head of the campaign, Bernie Sanders himself, did not thoroughly condemn, what he said was he disavowed them, but he doesn't think that they're really part of his support base. And the fact that there were actually, like, people who are are smart for the most part when they vote. They vote based on, reasons that are not just a pure policy paper. People aren't reading a list of policy positions and checking the one that they agree with the most. They're voting for a person. And Elizabeth Warren appealed to people in a way that Bernie Sanders did not. I mean, they're very, very different people. Warren was very thorough. She had a plan for everything. She was not combative and, your grandpa screaming at you. And, but I do think that people were really offended on a deep level by the actions of a few, because the actions of a few were so extreme and they were not thoroughly disavowed from the top.
CR?
I mean, this was such a blow to the Sanders campaign. They have been so popular in Washington, really since 2016 when he won the caucuses here. And it was one that they were going to win up until, just a few weeks ago. I think what happened here is the same as what happened almost every other place for Sanders, which is that this isn't 2016. Two things have really changed for Sanders, and that's why his support is weaker now than it was then. And one is there's been closer scrutiny to his plans, and the costs have been looked at with a fine-tooth comb in the way they weren't in 2016. I mean, Medicare for All, starts totaling $31 billion, and the Green New Deal is $16 billion, and you start adding these up, and there was sticker shock like there wasn't in 2016. And secondly, the big factor, again, you're seeing it across the country, not just in Washington, which is the sort of Trump background. In 2016, it was kind of free to join the revolution, because you didn't really worry that Trump was going to win, or certainly many of them didn't. It was kind of an anti-Hillary thing, and it was a bit of a luxury. This year, the feeling is, now Trump is president. He can get elected, and you don't really have the luxury, these Dems feel, of going with Sanders like you did before. And I think that explains the lack of appeal.
One last quick question, and then we'll move on. Should Washington State ever vote by mail in a presidential primary in early March ever again?
Yes.
Yeah.
Absolutely.
What's the question?
Why wouldn't you? What's the argument?
You mean because
not?
coronavirus will hit, or
No, because people vote early, and people who are not running for president.
Well, you don't have to vote early, right? I mean, most people didn't vote early, right? I mean, they are waiting. You didn't. You could have had the right two choices if you just waited until the day.
I could have waited and not been an idiot.
Yeah. So vote by mail is still the right thing, and having it early, I think, is generally agreed is more fun.
But the truth is, the having it early did not produce those late last week visits from folks because of coronavirus. The candidates were here; they were here earlier. Bernie Sanders was here, fairly recently, but not this last week.
Okay.
To say Washington matters so much.
Okay, we got to go. So mail out the ballots with instructions. Don't do anything with this for 3 weeks. Yeah. Okay.
If you had two candidates,
listen.
Yeah. Well, we'll see about that. Okay. More. How you feeling, Erica? See,
there was a cough. Okay.
That was a cough, a sneeze.
It was a neither. It was a clearing my throat.
Oh, throat clear.
But I think it was in your elbow, so I think it was all
I'm actually under the desk right now.
Yeah, maybe a word about elbows in a moment. We're going to return to Week in Review when we come back.
Support for KUOW comes from East West Bookshop, presenting The Work, a day workshop focusing on finding relief from suffering, depression, and discontent, with author Byron Katie, March 28th from 10 a.m. to 5:30 p.m. at Seattle First Baptist. Tickets and more at eastwestbookshop.com.
This is 94.9 KUOW, Seattle's NPR news station. Sound stories, sound voices. It's about 5 minutes till 3 o'clock. Rainy and 39 degrees in Seattle. Overnight will drop to 34 degrees with a chance of rain and or snow. That will continue into tomorrow morning. Then the afternoon is going to be partly sunny tomorrow.
Support for KUOW comes from the Startups and Emerging Companies Group at Ryan Swanson Law, lawyers helping young and growing businesses with entity formation, financing, intellectual property, and more. More information at ryanswansonlaw.com.
The Week in Review, time to wrap it up here on KUOW. Look, if you're in this room doing a radio show, you're better off than a lot of people right now. So I don't want to dwell on our relatively little problems. I'm just curious for a quick take, Erica C., CR, Joni, on just daily life as you've noticed it. Anything surprising, anything vexing, anything, God forbid, inspiring?
Well, I'll tell you one thing that I have found since this has come up is that people are really outside a lot, because that's one good spot for you. I mean, I've ramped up my running. I'm in Seward Park more. There's a ton of people in the parks because that is a safe space. You can have social distancing like crazy in the park. And,
Yep.
you know, I was running by some folks I know who used to work at the Seattle Times, and we stopped. We were about 6 feet apart, we, you know, talked a little bit and then kept going. But people know that that's a good place. It also supposedly exercise bolsters your immune system.
Right. They
Yeah, I'm gonna
cannot
have to
take the
start doing
outdoors
that.
away from us. They can't take that.
I think my gym is about to close. I go to the YMCA, and I haven't gotten notice yet, but it seems like only a matter of time. So that seems like great advice. I mean, it's warming up. I mean, this weekend accepted when it's supposed to be cold, so it will definitely be like a lot more pleasant. It's good that this wasn't hitting in January. I mean, that's one small blessing. And I'm still going to restaurants. I mean, for the time being, I put up a Google map of Asian American owned restaurants, which you can find on my Twitter, Erica C. Barnett. And it's a great crowdsourced list. I didn't come up with the list. It was totally crowdsourced, and it's places you can go to fight discrimination, which we've seen a little bit of, and to support local businesses.
I'm a guy that kind of goes against the crowd anyway, a little bit contrarian. And so in a weird way, I kind of love the atmosphere now. I'm not saying I love the problems and it's a pandemic and all that kind of stuff, but like I'm going to the gym and I'm loving that no one's there. I'm going to the
it's so
I'm
great.
going to the
Driving.
grocery store and I'm loving no one's there. I'm loving that there's no one on the freeways. I mean, I actually like being where no one is, and in a weird way, this is accommodating that weird trait of mine.
I heard at my dentist's office, they said something like, it's like Seattle was 20 years ago. You've
Yeah,
been
that's
pining
true.
for it.
Yeah.
Go
That's
enjoy
so funny.
it.
I was downtown the other day and I was taking pictures of the empty streets, and I thought I moved here about 20 years ago, and that's exactly what it felt like. I was shocked at how empty Seattle was 20 years ago, and now it feels like we've wound
So
back
I would
the clock.
say if anyone has take some weird pleasure in some of this if you can, because it's otherwise very depressing.
I've been talked out of the elbow bump. First of all, I'm rarely coughing, but when I do, the idea that I'm a coronavirus carrier and my virus will make it around from the inside of my elbow to the outside of my elbow, and it will transfer to the outside of your elbow, and the outside of your elbow will somehow touch your eyes or your nose or your mouth, seems very unlikely to me. But on the other hand, why risk it? I'm now bowing and waving and namaste. I know there are a lot of we've spent the last hour covering a lot of real, true suffering in different ways, medical and financial and otherwise, and it's very serious stuff, and we're going to keep doing it. I just also want you to know that I just appreciate the humanity of you all, journalists, experienced journalists, and good people coming in and sort of, talking through all aspects of this with us. Thank you.
Well, thank you.
Thanks. It's
Thank
nice
you.
to talk in person for as long as we still can.
Yeah,
Yeah.
we're a few feet away from each other. We're social distancing ish.
I haven't touched anyone yet.
You haven't touched you. You're not touching me. Not today. Thanks,
There is a
everybody.
song like that, however.
C.R. Douglas from Q13 News, Erica C. Barnett, the C is for crank.com, C.R. Douglas of Q13 News, and the show is produced by Sarah Leibovitz, live streaming on Facebook by Juan Pablo Chiquiza. Thank you all so much. See you soon, okay?
You bet.
Hi, this is Bill Radke, host of KUOW's The Record and Week in Review, and I'm here at work. I'm not working from home. I'm working from work because this is where we broadcast. And we decided that bringing you breaking news, answering your questions, talking to your leaders at a time like this during this virus outbreak, that's an essential service. You rely on us, and we want to be here for you. I'm letting you know that it takes not just people, but money as well to cover breaking news. For producers and engineers, and these days bringing in safe food and disinfectant and all that, on top of the cost we already have, equipment and paying for network programming and all that, what you hear about at the pledge drive. I'm asking, would you please take a moment and donate something to KUOW? Give a little money so we can keep local independent journalism on the free airwaves. You rely on us, we'll be here for you. Thank you so much for your help.